Hello everyone, today we're going to talk about our illeocecal valve. So you're probably wondering, what is your illeocecal valve? It is a valve that sits between the small intestines and the large intestines. So we eat food, and we swallow it, it goes down our throat, into our stomach, and into our small intestines. And in the small intestines, the food is absorbed into the body and utilized for what it needs. And once it gets to the illeocecal valve, it either the food will stay there or it will pass through. So this ileocecal valve has to open up to allow the rest of that food to pass through to the large intestines. And the large intestines is sort of like our waste container where there's no absorption really that happens at this point. It's just a storage for it to exit the body. So let's for a moment imagine that we have a basement, and underneath the basement is a sewer. So we have a large rainstorm, and all of a sudden that sewer water comes up into our basement. We have a flood. So think of the ileocecal valve as it helps to protect the body so that waste do not flow back into the small intestines, because if it does, then we have a potential for health conditions to arise, because now waste material can be reabsorbed into the body, which we do not want. So if you have a faulty ileocecal valve, this is a possibility and could be part of the reason why you're having IBS symptoms, either chronic constipation or constant diarrhea. So if you've gone to the doctors and you've ruled out like appendicitis or anything like that, that could be something that's an emergency situation, and you've been diagnosed with IBS, you can try the ileocecal valve massage that I'm going to show you in a moment and see if that is helpful. So I'm going to show you a little diagram of here are your large intestines, and these are all of your small intestines. So where the large intestines and the small intestines meet, this is your ileocecal valve here. So some things that can affect the ileocecal valve is stress is a really big one. That can cause this to misfire. Also nutritional deficiencies, because if you don't have proper mineral absorption and stuff in the body, then that can lead to chronic cramping in this ileocecal valve. And then that can cause constipation because no waste can come out. Also, parasites in the body too can irritate this ileocecal valve and it won't function properly. Your microbiome and your gut is out of balance. That will cause it as well. And any type of abdominal surgeries that can cause scar tissue, because then you get pulling on different areas in the abdomen, which can pull on that ileocecal valve, and then it wants to fire back by contracting so it can stay in the position that it wants to. And this is like a constant cycle back and forth of this this cramping down in there, and that will cause constipation. So I'm going to show you next how to locate this area in your body, and if you do have a problem, it's probably tender, and I'll show you how to massage it, and hopefully this might give you some relief. It's not going to get down to the whole cause of what is causing this dysfunction, but in the meantime it can help to calm down some of those symptoms. So coming up, we'll do the ileocecal massage. Okay, so now we're going on to locating our ileocecal valve, and we're going to do a little massage for it. So we're going to come to the top of our hips and slide forward to where we feel a little bone that's sticking out, and locate our belly button. And then midway between there, approximately, and maybe a little bit lower, would be where your ileocecal valve is. So you're just going to press in there and just feel around until you feel the tender area. And once you've located it, you are going to lie back with your fingers firmly down about an inch into the belly there. It shouldn't be painful. If it is, back out of it, but we do want some firm pressure. And then we are just going to be doing little circles around and around and around. And you can apply this pressure and work on this for about 3 minutes. And it's recommended that you do this before mealtime. So if you're having trouble with like constipation, then things can flow out. If you're finding this is
being a little bit too stimulating to the colon, then just stop. Another thing that I find helpful for constipation is using a heat pack in conjunction to this. And if you have IBS, like where you're running to the bathroom all the time with diarrhea and that, a cold pack might be more beneficial for you and less stimulating for everything to want to flow through the colon. So give this a try. If you have any questions or comments, please leave them down below. If you have not been to a doctor for your condition, I recommend that you go and see a professional, because if you're having severe abdominal pain, it could be a sign of appendicitis or even like a hernia or something that could lead to an emergency situation. So if you're not sure what's going on, check with your doctor first before trying these tips. And take care and have a wonderful day. Bye.